Good evening, everyone. Today, I would like to teach you about administering oral medication. Since you are going for your practical in the ward, for your RM assessment, serving medication with the clinical instructor and also with the staff nurse. So, before that, you need guidance how to give oral medication properly.
Okay.
Before we start, we should know the objective of this learning. It is to equip student nurses with the fundamental knowledge, skills, and also attitude necessary to safely and effectively administer oral medication in accordance with clinical guidelines, and also patient safety standards. So, by end of this day, learning outcomes, by end of this session, student nurses will be able to, you can define oral medication and understand its purpose, and also identify indication and potential complication as well of oral medication, and prepare appropriately for medication for administration, and demonstrate safe and accurate oral medication administration technique. Then apply the right medication administration in the clinical practice. So before that, we should know the definition of the oral medication. Oral medication is the medication that are taken by mouth, we swallow, and absorbed through the gastrointestinal GI tract. And the common form usually is from tablet. Usually, what you usually take paracetamol is the tablet, capsule, usually the antibiotic, syrups, also medication fever for the kids, suspension, and also elixir.
What is elixir?
Elixir also seems like syrup.
Oh, syrup.
Any question before I further ado?
Oh no, only this. It's new to me.
So the introduction, before that, the oral route is the most common and convenient method of drug administration. It's very easy. You give the patient, you eat, you swallow. It is non-invasive, no puncture, no nothing, cost-effective, and also generally safer. Not like IV medication or from other routes. It is require knowledge of pharmacology. You need also to know the patient safety and also ethical practice. Administered by the nurse based on the 10 rights of medication administration. Before this, we have 5 rights of medication, but right now I think they already extend to the 10 rights of medication. Okay, the indication of oral medication. One is to treat acute and chronic condition such as hypertension, infection, and also diabetes. Let's say you have hypertension, your blood pressure reaching 180/90. So doctor prescribe you amlodipine 5 mg daily. So that is to treat your condition, your hypertension. And then second, to maintain health. Example, vitamin supplement. So when you are younger, you have more collagen, something like that. So when you're older, you need more supplement. Maybe you have knee pain, so you need supplements such as folic to increase your collagen in your knee. What is it called that? Synovial fluid. What is the supplement usually? Vitamin C? No, other.
Multivitamin.
No.
Magnesium.
Okay.
What? I always just took vitamins.
Vitamin C. Okay, good for your health as well. Then what else? Some more vitamin for pregnancy. Usually folic acid, multivitamin for pregnancy. There's a lot of brand in our pharmacies.
Obimin.
Is it Obimin? Folic. yeah, to increase your HB, because sometimes when you're pregnant, your HB sometimes drops, so you need to increase to maintain your pregnancy in a good scale. Okay, and some more prevent disease. Okay, let's say this is sometimes can be prophylactic medication. Sometimes if you have UTI fever, then doctor will prescribe you with antibiotic 5 days, 7 days, depends on the doctor prescription. Let's see. What happened? Let's say doctor prescribe Tamsunet 5 days, 7 days, and then after 2 days you feel very well. You discontinue your medication. Should be COVID, because what?
Recurrent.
You can
Human
antibiotic resistant. MDRO. Okay. Do you know any other antibiotic? Since you are already
Flagyl.
Hmm?
Flagyl augmentin.
Flagyl augmentin, that's the common antibiotic. Okay, right. You already study pharmacology, right? For this?
Yes.
Okay. Then some more, we can to control the symptom. Let's say post-op care pain. So doctor prescribe painkiller, such as what? Common painkiller.
Paracetamol.
Paracetamol. Okay, good. And then
Ibuprofen.
Okay.
Morphine. Celebrex.
And also, if let's say you are early in your pregnancy, you have hyperemesis. So to treat the symptom, control the symptom, doctor prescribe you something to control nausea, such as others.
Registrol.
Oh, okay, that is from medication.
Yes. And another vitamins.
Vitamin.
Yes. For increase the nutrition.
Alright. Risk factor or the complication. Usually aspiration in patient with swallowing difficulty. Usually we can find aspiration in patient with swallowing difficulty in which patient? Stroke patient, yes, patient bedridden, that cannot
Aging.
GERD, old patient. So if like that, usually what is the medication? What is the route that we can give to make medication for this kind of patient? IV, or maybe if they have NG tube, yeah, we can give through NG tube. And also allergic patient. Usually, if the patient first time you administer this kind of medication to the patient, so you have to watch out signs and symptoms of allergic patient, such as itchy, difficulty in breathing, maybe the difficulty to swallow, or itchiness, redness. But the difficulty in breathing, you need to take it very seriously, because sometimes patient may have cardiac arrest or respiratory distress. Gastrointestinal upset, such as nausea, vomiting. Some medication you need to educate the patient to after eating or before meal, or you need to at least have some snack before eat. And also it will make the absorption more faster. And then incorrect dosage or timing. This is also we need to be aware. Incorrect dosage. Let's say you have hypertension, right? I mentioned earlier. Your dose is amlodipine 5 mg. But because sometimes we have tablet 10 mg and we do not check properly, then we give one tablet that is contained 5. We're supposed to divide it by 2. So what happens if we take overdose?
We need to inform.
During your blood pressure, we want to reach it until this certain time, this certain reading, but it will drop much. Then you have to be prepared with the other side effect. Maybe BP drop, patient fainting, like that, nausea, dizzy, like that. Or the timing. Timing, let's say if BID we should, BID means what?
Twice.
2 times per day. So let's say give 8 morning, 8 o'clock. If possible, we try to give, let's say in the morning we give 8 o'clock, then in the evening
6.
at least 12 hours, 12 hours apart, 12 BID. Not to give earlier than that. Maybe can, if let's say
1 hours.
Drug interaction or food drug interaction. Patient non-compliant or refusal. This is some of the risk factor of the complication. Sometimes patient, when we give the medication, patient did not take the medication immediately, then put the time 8 o'clock. But when you come and check, patient still did not take.
Understand.
So the time you already signed 8 o'clock, but actually when you come back around 9 or 10, they did not take the medication, and also patient refused. Even though you already explained pro and contra, something like that, patient still refuse. So you need to inform to the charge nurse or the doctor, so they can take further intervention with patient. Preparation before administration of the oral medication. First, we need to verify the doctor's order, and then check the 10 rights of medication. Assess the patient ability to swallow. Like this one, if the patient is old lady, old mama that cannot swallow and headache, you should not give oral medication to the patient. And also you need to gather supplies, because we work in hospital. If possible, we maintain our professional. Not bring the medication, put in the pocket, then give to patient. We should be professional. We should bring the computer or the medication chart, tray, water, and also glove. If the medication, if we need to use glove, if the patient is in isolation or infection, and educate the patient about the medication. This one, before we give the medication to the patient, we should know what is the medication, what is the purpose. Otherwise, patient nowadays they have all their info into the tips. Sometimes patient know better than you, so you should know better than them, not them better than you. Okay, this is the 10 rights of medication administration. The right patient. One is right patient. By what? We should check by what?
Identification.
Identification. One is full name of the patient, then also URN or medical record number of the patient. Okay, let's say you know the patient, Sabah. Okay, Miss Sabah, this is your medication. I did not check the tag, but I know your name is Sabah. But actually, when you check, the patient name is actually Sabah, yeah. But in the medical record, Sabah Le. And you need to check also the URN. Sometimes the URN is different. Right medication. Right medication. Okay. Is there any medication that you know that same name?
Yeah, looks like
Example? Bagi contoh je.
atropine.
Tak, ini oral medication.
Looks like, sounds like.
Celebrate and Selesa.
Celebrate dengan apa?
Selesa.
Okay. Saya start
Xanax and
Celebrate dengan Selesa
Ah.
Selesa. Okay. Okay, let's say you want to give right medication to the patient, but sometimes you in hurry. So you give, instead of giving the patient Celebrate, which is painkiller, you give another medication, Celexa. Because you mischeck properly, you give the patient. That's why the importance of checking the right medication to the patient to prevent lookalike stimuli medication confusion. And also write dose, like I mentioned earlier. Even though the medication is already correct, but you check the dose. Sometimes the pharmacy supply one tablet. You thought it's 5 mg, but it's actually amlodipine 10 mg. So you need to check the dose 5 or 10 mg. If 5 mg, you need to cut, make it half and give to the patient. Okay, right route. So sometimes there is medication that you can give through oral, IV, sublingual. So you need to check properly. Sometimes, let's say maxillary metoclopramide, doctor asks to give oral, but you give IV because you mislook also. You did not check properly the order. That's why the importance of medical MAR, medication record. And right time, I mentioned earlier about the BID. How about TID? TID means what?
3 times a day.
3 times a day. Okay, 3 times a day,
6 a.m.
6 a.m. 8 a.m. also can
8
be.
a.m. can be 2
2
p.m.
p.m.
and 22.
22.
8 hours ago.
At least 8 hours interval. And right documentation.
Oh no, we not.
Okay. This one you can put in your nursing.
Ayah beli cepat-cepat ni dia beli.
Tak kaya
masalah dia. Alah kan.
Okay, we continue with the 10 rights. Right documentation. So after you give your medication, please document in your track care or your nursing notes or your nursing progress. And then right reason. Right reason is the what is the indication you give the medication to the patient. Let's say patient has hypertension and the blood pressure is kind of high, so you give amlodipine. You explain patient. This is to treat to bring down your blood pressure. And then right response. So after that you check the response of your medication. Let's say after 1 hour you give the amlodipine to the patient with the high blood pressure. You check the blood pressure to see the response of the medication. And right education. This is pre and post also. So pre is like you educate the patient why you need to take this medication as prescribed by the doctor. The indication to the patient, the side effect to the patient, especially the side effect. Then after that, what you need to watch out after giving the medication. And the last one, 10 is right to refuse. So patient also have the autonomy to refuse. We cannot force the patient. Patient also has their own reason why they refuse to take the medication. Okay, so far you can remember the 10 right? You have any? Okay, so you clear with the 10 right of medication. This 10 right of medication you need to memorize by heart, by book or by group.
By minute.
Yes.
Can I ask something?
Mm-hmm.
If the patient already have hypertension, but she refused to have the amlodipine, what we should do?
We should explain back to the patient, emphasize that if patient still refuse, so you need to monitor the vital sign and you need to inform the doctor immediately because this attitude can make her life in danger.
Okay, thank you.
But must inform the doctor. So maybe when the doctor come and explain, patient will more understand. Sometimes patient listen more to the doctor than the nurse.
Okay, yeah. That's right.
Okay, next procedure summary. Before that, we need to perform hand hygiene. It's either hand rub or hand washing. So you need to memorize also your 5 moments of hand hygiene before you serve your medication. And identify the patient using 2 identifiers, like I said earlier, using the URN and also patient. You have to ask the patient full name. Explain the procedure and also the medication. Administer the medication one at a time with water. Because sometimes patient have 5 or 4 different medication and you give the patient all 5 in her hand, then you ask her to swallow. No, it should be one at a time.
So even be small and big. One.
Yeah, it should be one by one. Ensure the patient has swallowed it completely. Sometimes this one, if let's say you give medication to the psychiatric patient, so you have to see where the patient swallow. Sometimes they can hide it under the tongue or under teeth or somewhere else because otherwise the purpose of the oral medication is not achieved. And also document if administration accurately. So if oral, you sign oral, not IV. not sublingual or whatever. And then monitor for any adverse effect. This is, let's say some patient first time taking this medication, you need to emphasize about the side effect of the medication, or some medication that will make gastric, usually painkiller. If the patient did not take snack or something pre-medication, because something will make stomach upset. So the conclusion, okay, we reaching to the end of the session. So conclusion, oral medication is a core nursing skill. Even though it is a simple procedure, but it is essential in daily activity, hospital, clinic. Always prioritize patient safety by adhering to the 10 rights of medication. This when I emphasize to you, you have to memorize by who or by who. Be vigilant for complication or adverse effect. Sometimes patient complain something like this, but you take it very lightly. So you should document also for other reference. Maybe sometimes patient complain of itchiness somewhere, but after 1 hour, 2 hours it subsides. But still, it is considered side effect of the or allergy reaction. So you need to document. Effective communication and also patient education are essential. So we are, as a nurse, we should use communication as two-way, daily effective communication with the patient. We should always emphasize pre, during, and post. Okay, I have question. Do you have question? Okay, let me ask you.
Okay.
Okay, which of the following is not one of the 10 rights of medication administration?
B.
B.
Right.
Okay, next. Okay, before administering an oral medication, which action should the nurse perform first? Number 1, ask the patient to drink water, document the medication, check the medication order, or call the pharmacy. C. Okay, oral medication is absorbed primarily in which part of the body?
Stomach.
Stomach.
And small intestine.
And number 4, a patient with difficulty swallowing, dysphagia, is at risk for what complication when taking oral medication? Number 1 is hypertension, aspiration, rash, or hypoglycemia?
Aspiration.
Aspiration. Okay, good. Okay. And last one, this is reference that I took my slide. And thank you for listening. I hope you enjoy and you can practice whatever I teach you in your clinical lesson.
Thank you,
Right.
ma'am. Rock your body.